Welcome to This Week in Health IT events, where we amplify great ideas with interviews from the floor. My name is Bill Russell, Healthcare CIO, coach, and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. We want to thank our founding channel sponsors who make this content possible, Health Lyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. This episode is sponsored by Health Lyrics. When I became a CIO, I was really overwhelmed at first, and one of the first things I did was to sign a CIO coach to walk with me through the journey. This was someone who had wisdom that can only be gained through years of experience. It was invaluable to my success in the role, and I now coach CIOs through Health Lyrics. If you want to learn more, visit healthlyrics.com or drop me a note at bill@thisweekinhealthit.com. Over the next 3 weeks, we have a real treat for you. We just got back from the CHIME Fall Forum in Scottsdale, which was a fantastic event, and we caught up with 12 active CIOs from various size health systems and asked them to take a look back at 2019 and a look forward at 2020. You're going to hear what they are excited to have accomplished and what they are looking forward to accomplishing in the next year. I asked each of them the same 8 questions, and I think you're going to be as fascinated as I was to hear the similarities and the differences from CIOs. Each of these interviews is around 10 minutes long, so you can really listen to them quickly, especially if you listen to them at 1.5 times speed, as I know some of you do. And we're going to publish one a day with a few Newsday episodes sprinkled in through the end of November. So check back every day for the next episode and look back to see if you missed any. That is all going to start on Monday. Today we have an interview from the floor with Lesley Krickstein and Marie Savickis, the CHIME Congressional and Federal Affairs Liaisons on Capitol Hill. They are working on so many things, it's really amazing. We hit on 21st century cures, cybersecurity, national patient ID in this brief interview. I hope to have them on more frequently to share the great work that they are doing. Have a listen, and I hope you enjoy. We're doing another session from CHIME Fall Forum in 2019, and we are going to talk public policy. I'm really excited to be joined by the two of you, Lesley and Mari. And actually, why don't you give your roles, because you're congressional and you're more in a different area, but introduce yourself to them.
Yeah, so Lesley Krickstein, I'm CHIME's Vice President of Congressional Affairs, and I am responsible for trying to stay on top of all of the dysfunction going on Capitol Hill for the CHIME membership. So it keeps me busy. There's lots of excitement these days, and lots of challenges cutting through the noise.
So really dysfunction?
Dysfunction. We, are hoping to just keep the government funded through Thanksgiving, let alone tackle some of the bigger policy issues like surprise billing and drug costs. And as we sit and wait for some of the forthcoming health IT rules and see where we may need to have Congress engage there. So there's some big policy conversations happening, along with some of the headline news that you're seeing each and every night.
So you are federal affairs. So can you introduce yourself?
Sure. Hi, I'm Mari Savickis. I'm CHIME's Vice President for Federal Affairs, and I have the flip side of the coin with Lesley, where I basically read and digest the thousands of pages of government regulation on any given day and try to translate into what that means for practical realities for our members. And there's no day off for the agencies. They don't take recesses. There's always something coming out on any given day. So it's just trying to keep pace with what's happening.
And that's really fun reading.
It's it takes a certain kind of individual to want to read government regulation, and I happen to be that crazy person.
Well, that's great. So we're going to talk about a lot of, we're going to try to get really pragmatic here. And you guys send out a great, to the CHIME membership, you send out a great thing. And so I'm actually just going to walk through this because there's so much here. So Stark, anti-kickback, where are we at on that? And what is that about and where are we at?
And it's a big deal to open up Stark and anti-kickback rules. So these are issues that govern the healthcare sector of a particular interest to our members as providers. You don't want to be inducing referrals inappropriately. And so one of the things that we've been advocating for the past several years, knowing that there's only a few ways to really incent financially good cyber hygiene through government incentives is to look at ways that we can leverage existing revenue streams. And one of the ways that we went about doing this was looking at Stark and anti-kickback. So we finally saw in the proposed rule an ability for a provider who's, say, a better resource to donate cybersecurity technology and services to a lesser resource provider. And it's not mandatory, it's voluntary. So we know that there are some of our members who would have a strong desire to take advantage of this, and others that have no desire. But it nonetheless is a recourse. It's not final, so this is proposed. We'll be commenting and engaging our members for feedback and input, because the comments are due at the end of the year.
But this is huge. I mean, because the Stark laws allowed us to digitize a lot of these physician practices, individual physician practices that were out there. But we didn't really do much after that. And without cybersecurity is changing on a daily basis.
Absolutely, and we've been busy trying to hit reboot on the sector collectively, and many of our members are actively engaged with an industry-wide effort to try and improve the cyber posture of the healthcare sector. So it's a volunteer effort, it's free, we do a lot of work with them, and we're very engaged. The other thing I want to mention about the Stark and anti-kickback rules is that it extends again, if adopted and finalized, the EHR donation way that you can donate an EHR to a lesser resource provider. That was set to sunset in 2021, but under these rules that would be extended. And then there's also a series of changes that they've made that would promote value and care coordination.
Wow. We probably camp on that.
It's a lot to unpackage. Yeah.
We probably camp on that. But I want to talk 21st century cures. So which one of you is like the expert on 21st century cures? Is that
it depends what way it's coming through. So, I mean, this was landmark legislation for the entire healthcare industry, right? It had a number of efforts to speed biomedical research and bring cures to patients. But then there were about 40 pages of health IT statute that really will dictate our industry moving forward. And it came on the heels of years of hearings and stakeholder roundtables and meetings. And one of the things that was kind of became the buzz phrase was information blocking. And so the rule dictated to ONC that they need to start promulgating rules on how to spur interoperability, how to create this network of networks, but also how to stop information blocking. And so, Congress, to the extent that health IT is getting attention, has kind of taken a step back because we do have the rules that are currently pending. So I think we will see congressional action kind of once we've seen those rules and see if they're actually going to mimic what congressional intent was for the various provisions that call for action. But that's really, where my side of the house is right now. It's in limbo.
Because 21st Century Cures was the last administration. Do you see a lot of continuity in healthcare across administrations?
In the broadest sense, no, of course not. But in the health IT space, I think, naturally, even as national coordinators changed and as, frankly, leadership on Capitol Hill changed, you saw folks prioritizing different IT issues or opportunities. So I think there has been commitment to interoperability. We had the interoperability roadmap that dated back years to the last administration. That really took off on the Hill, and where folks became very passionate about all of the different things that we could do to spur interoperability. But you're right, that's the reality of our democracy. Is it may have been passed by the last administration under a few Congresses ago, but now it's up to this administration to carry out. So I don't know if you want to pick up on that.
So the CARES Act was signed into law in 2016, and now this is there's several year lag time. And so, to Leslie's point, the rules are now coming out, and they're going to be operationalized very shortly. We're waiting on the final rule for CMS and ONC concerning the interoperability rules, the dual companion rules that will govern what I've been calling the next decade of our industry. So we're of course on pins and needles waiting for that to happen. And to Leslie's point, there is a bit of been the ball carrying forward from the last administration. I would say the name of the game in the next era is going to be the consumer. And so it's all about engaging the consumer and making sure that the consumer has access to their data as quickly and as securely as possible.
Well, I mean, so we've at HIMSS last year we had Anish Chopra on the show, and he talked about how this in healthcare, it's been relatively consistent drive towards interoperability, towards transparency, data sharing, in the best interest of the patient. Because almost it doesn't matter what your political background. Do we want to do what's in the best interest of the patient? Yes. Do we want to share the data with the patient? Yes. And so there's been consistency. And I also had Don Rucker on the show recently, and we were talking about this. But one of the things that's probably more pronounced, feels like it's more pronounced in this administration, is Don just came out and said, we want to make healthcare a market. And in every market, it's transparency of price, so you don't have surprise bills. It's choice, and it's access to data around the services, the quality of the services you're going to receive. And then recently I was at the health conference and heard Seema Verma talk, and she just drove that home. And it seems to be the whole push right now. Is that what you're feeling?
I think that is, and there's a counterweight to this. So on the one hand, this is all like moving in the right direction. Patients should be engaged consumers. There should be transparency about cost, and they should have access to their data. But on the flip side of this, one issue that's been emerging is making sure that their data is not used in a way that they didn't intend it to be used, such as the commoditization and data aggregation of it. And so there needs to be some protections that are put into place around how, say, healthcare data is married with other consumer data. So there's two different regulatory schematics that govern these spaces. There's HIPAA that governs the providers and payers, and then there's the FTC that governs third-party apps. So we've been trying to wrestle that dragon down and try to figure out how best to ensure that patients are informed about how their information could be used, while at the same time facilitating quick and seamless access.
And that also marries well with the broader conversations happening on Capitol Hill, with you're seeing tech giant after tech giant brought up, set before a congressional committee, and the dawn of what is privacy with CCPA and GDPR. I think there's a call to action for a national privacy standard law, same with breach, but there still remains some significant issues to be resolved. And so how healthcare fits into that, and to what extent non-covered entities kind of end up under other jurisdictions, and how we can better empower patients from the outset, I think is something that we're tracking closely. And a few bills have been introduced, and I expect that to continue to be of interest to folks that are focused on healthcare.
So let's talk cybersecurity. We did a little bit earlier. It's interesting. When I was CIO, I would have to sit in front of the board and I'd say, look, if a nation state attacked our health system, they're getting our data. And that seems so defeatist to me. And the analogy cybersecurity CEO gave me is said, look, here's the deal. Some of these nation states have set up attacks directly on your health system. They've essentially put aircraft carriers on the coast of California, and they're attacking. And we're asking each individual hospital to defend their turf against that kind of attack. He goes, until the federal government steps in and starts to supply some help, because you're defenseless, is what he essentially said to me. But it seems kind of defeatist. Is the federal government, is Congress looking at this and saying, hey, we've got to start to help?
Yeah, I think there was a recognition with the passage of the Cybersecurity Act back in 2015, broadly, that we could do a better job of at least sharing information and bringing the government in and setting forth exactly what a reporting structure would look like to make sure that at least you can share what you're seeing and how it may be impacting your health system versus another. But in there was also a specific section looking at healthcare. So that was the first time that lawmakers, put a stake in the ground and said, healthcare is probably behind where everybody else is and is nowhere near where the industry should be. So we're still seeing, I would say, reaping the benefits of that statute and that legislation, in the sense that it created a task force, and the task force created recommendations, and then from the recommendations, best practices, and then changes to the Stark Law. And so now that those things, that cycle is running, the cycle of policymaking, we are seeing from tech leaders on Capitol Hill interest in going back to the drawing board to say, we need to specifically help those that are small, rural, under-resourced, and what does that look like? We know the money trees have kind of shriveled up and gone away. It's not like we're going to get another meaningful use for cybersecurity, unfortunately, even though that might be what it takes. Or, one of the suggestions in the task force report relative to medical device security was like a cash for clunkers program for outdated medical devices. Again, if we had another stimulus, that might be a great opportunity to change things. But being realistic about our current budget situation, that's probably not possible. But I do think there is renewed interest. I think there's commitment, and I think there's also a recognition that providers aren't actively saying, come take my data, right? One of the CIOs I was talking to last night equated a cyber attack to, if someone came in and stabbed a patient in the ED, the hospital's not going to be liable for that action. You're going to charge the person who committed the crime. How is that different than if someone came in and held your system ransom? Why is the health system being the victim? And so one of the things that we were really encouraged about in the broader healthcare cost conversation, there is a provision that would direct OCR, right? The agency that every healthcare entity fears, because there's usually fines associated, that if OCR is following up on a potential breach or is considering an audit, that they should take into account if a health system is following publicly available resources like the NIST Cybersecurity Framework or the practices outlined in the Healthcare Industry Cybersecurity Practices, the HICCUP guidance, which was created out of the Cybersecurity Act of 2015. So
how do you stay up with all the acronyms?
We live in Washington.
Yeah, I block off 15 minutes of my day every day to make sure that I have alphabet soup under control. So there has been a lot of progress. I think there's been progress in terms of education of lawmakers, but I think we're also trying to do the work of educating the provider community. Right? It's challenging, it's new, and it's scary. We know resources are finite. The decision between investing in IT and IT security and finding the qualified professionals to be able to do that. This is a very complex conversation that unfortunately right now doesn't present with a lot of easy answers.
And we've been also collaborating a lot with the sector and also the federal government, and that's part of the reboot on our sector, to try and hit refresh. How are we going to work more cohesively so that we can improve the cyber posture overall? And so that's been, many of our members are involved in the Health Sector Coordinating Council and the joint effort on cybersecurity. We just did a podcast with HHS where we locked arms and talked about what the progress that we've made and the things that we have to look forward to. And we've got a long ways to go, but we've also made a lot of progress. We've seen a lot of good developments from the FDA. A lot of those recommendations that Lesley referenced in the industry report on cybersecurity are now coming to fruition, just like the Stark and kickback, which was recommended by that group. And so there's work that's being done to improve the posture. So I think that it's nice to acknowledge how far we've come, but we still have a ways to go.
Yeah.
So I want to talk telehealth, national patient ID. I also want to talk about the work that you're doing, and we are seeing CIOs go to Capitol Hill and have conversations. We're also seeing state engagement, those kind of things. But two more policy things. So telehealth from a Medicare standpoint, from a CMS standpoint, they're trying to do something pretty progressive with telehealth. Can you give us a little bit?
Yeah, a lot of this, I'll let Lesley talk. There's been actually a fair amount of activity on Capitol Hill to actually move the ball forward, but still we have a lot of challenges with again, this is very wonky, but they call it 1834M of the Social Security statute. It's the area of the law that says that, you can only do certain things with telehealth. And so we've been busy, trying to push the needle forward on this, both from a regulatory and a statutory side. And so, for example, the current administration has actually moved the needle forward. They now pay for certain remote monitoring visits and or e-consults, like with a physician to physician, or if a patient needs to check in with their clinician. So between that, there's actually been a fair amount of progress, and CMS each year usually adds a few extra services to their list of telehealth, but we still need a lot more action, and that's where we go to the Hill, where we need to remove those statutory barriers, and that work is fairly underway.
Yeah, there was a fairly comprehensive telehealth proposal introduced last week, bicameral, bipartisan, from the Telehealth Caucus membership, and it really does look to at least expand CMS's capabilities to reimburse, right? So there's a lot that folks are doing with private payers, right, that are thinking more creatively. You're seeing new entrants into the marketplace that are offering these kinds of services, but unfortunately, Medicare is far behind. And so in a hearing before the Energy and Commerce Committee in the House a few weeks back, Administrator Verma was asked a few questions about telehealth and asked about, what's the value, what can we do to improve the outlook, and she said it's critical, and especially as they're looking at rural health and addressing some of the access challenges. But unfortunately, Medicare is bound by some very archaic statutory guidelines that, in this political, nonsense, it's really difficult to change something like 1834M because the Congressional Budget Office, which is something in Washington you get infinitely familiar with, because every time a legislative proposal comes for a vote, the CBO will give it a score, and if it costs too much, then Congress says, no way, we don't have the money unless you're coming with a pay for. And so CBO is convinced annually that increasing telehealth services will result not in cost savings, but additional costs, because I think it's going to result in duplicative services and overutilization. And so we continuously work with our members to try to paint the picture of, how can we be more proactive? How can we be more preventive? How can we look at keeping folks out of, the high cost environments? And unfortunately, CBO has been very, very slow to acknowledge, but we've seen progress in opioid and mental health. There's so much. They've taken a very kind of stepwise approach in looking at different disease states or different geographic locations to slowly start adding more reimbursement opportunities, but we still have a long way to go.
And speaking of costs, that's one of the things, while we have several members who are early adopters and first movers, the vast majority of our members can't afford to do telehealth because they need this spigot to be turned on by the government so they can get reimbursement, or by the commercial payers so that they can start funding the actual infrastructure associated with it. So until those two planets align, it's very, very hard to keep moving this forward. And so that's why we work on, it's a little bit of the reimbursement piece that has to be changed in order for that to really kind of take off.
And I think the other thing that we've really tried to drive home with lawmakers is it won't always be telehealth. It's just going to be delivery of healthcare. And whether it's, the traditional brick and mortar touch and feel and care experience, or if it's going to be delivered via a virtual platform, that's just going to be healthcare in the future. And so let's make sure that we're not hampering that evolution and meeting folks who, like me, very much like my ability to do a telehealth visit at
How
home.
often do you have people who don't live in your world look at you and say these words? That's crazy. Telehealth, first of all, the patient satisfaction is through the roof on telehealth, and we have the numbers to show.
We do.
Access goes through the roof, and cost gets reduced significantly. Who do we need to talk to at the CBO to say?
The wheels that change in Washington are very slow. It's a lot of hurry up and wait. It is just, I liken changing public policy to rolling a boulder up a mountain sometimes. It just takes a long time.
A lot of patience, a lot of conversations.
Yeah, it's telling the stories, it's having folks share the data. CBO likes particular sources of data. It's been a great source of frustration for, I think, folks in the health IT space because, just about every CIO can probably attest to the value that it would bring to their organization and frankly, to patients. But
Medicare too, they feel like they have to be very good stewards of taxpayer dollars. So there is this underlying current of whether or not, if you increase the reimbursement and the number of services that are allowed to be paid under telehealth rules, that there could be program integrity issues. And so there's that sort of in the low lying in the background. And trying to overcome that has been a little challenging.
They have to constantly be cognizant of fraud.
Exactly. And there was fraud. But there's a lot of opportunity too. So it's a balancing act, honestly.
Yeah.
See that? We could talk about a lot of things. National Patient ID. So you're getting some pushback.
We are and we aren't. For this being an issue that's over 2 decades old, and when I started at CHIME about 5 years ago, we were still very much afraid of the folks wearing the tinfoil hats. And, to see a bipartisan vote in the House of Representatives in favor of repealing the ban, it wasn't something that just got tucked into
It's not a ban on national patient ID. It's a ban on funding research for a national patient.
Correct. And so, what the industry, and I think a way that we really haven't seen over the last 20 years is, there are 50 plus organizations that we're working with that are all saying in unison, we've got to address this once and for all. Folks are generally solution agnostic. So, if the government wants to go down the route of an identifier, if they want to go down the route of expanding the Medicare beneficiary identifier, if they want to look at biometrics, or, I think folks are open. It's just a matter of the time has come, and if we really do believe that we need to be interoperable, which we all do, until we address this foundational element of data exchange, we're not going to accomplish the goals that high tech set out, that Cure set out, and that we hear Administrator Verma and folks in the administration saying is a top priority for them. So yes, we know where Senator Paul stands. He's very much carrying forth where his father is, and we did see some opposition from the ACLU. But I'm optimistic, given the industry support, given the fact that, a new day has dawned also in privacy and patient expectations, that I think we'll see some level of progress. Unfortunately, we've been victim of the broader political chaos and the fact that the government isn't even funded for fiscal year 2020. So hopefully that will get rectified, probably not in the near future, but maybe into early next year. But I still have optimism about getting some kind of significant policy change on this soon.
An election year, I'm sure curious what it's like for you guys to do your job. Will an election year really ratchet this up and make it more challenging?
I think, on Capitol Hill, we're already starting to see kind of the political gamesmanship with, of course, the House is moving forward with impeachment, and the leadership of the House is saying we've got to kind of show our worth, so let's look at some of these other healthcare packages, because they heard voters loud and clear in the last election that healthcare is a big priority. So you're seeing a lot of those messaging bills, so that sort of thing will pick up, and then you'll start to see we can't give that candidate a win, or we can't let the president get a win. So and things will come to a halt on the congressional front, but after the election and lame duck, I think it's going to be a complete free-for-all with an immense amount of opportunity. So it's definitely, the tension is going to be ramping up. I don't anticipate a lot of productive conversation, but in my world, health IT has been bipartisan. Republicans, Democrats have commitments for different reasons about, recognizing the need to do better with our federal investment. So from that vantage point, we've been able to stay out of the fray. Yeah. There's just a lot of noise that we're cutting through.
In election years, there's so much noise, it's hard to elevate. But the great thing about an election year is the year after an election year, everyone's trying to move the needle very quickly in that first year, especially the first 100 days.
Right.
So this is really setting the foundation for what's going to happen.
I mean, you asked about telehealth. I think, 5 or 6 of the Democratic candidates have included some kind of reference to telehealth in their healthcare platform. So I think tracking what that looks like and kind of seeing what the president might unveil in the healthcare space as well will be, worth watching.
On the regulatory side too, but as you lead up to an election, what they're going to do is they're just going to start pushing things out very quickly because they have to get that out the door before the election. And so we're already seeing pressure on the administration to get the ONC rule out, the CMS rule, and then there's HIPAA that is going to be coming. They just got the start getting a kickback. It's going to be just like a steady stream, and then probably the closer you get to the election, things will start to peter off, and as people really focus in on that.
You guys have already stayed longer, but is there anything you want to get out to people who are listening in terms of the work you're doing, how they can participate, what role members are playing?
There's really countless ways that you can engage on policy, whether it's working with us directly for responding to comments and those sorts of formal opportunities. we also get members with a lot of questions. I saw this in a bill, what does that mean for my health system? Or I don't understand this measure, and we're happy to kind of do those one-on-one, office hour kind of things. But we also, the last 2 years, have done advocacy summits in DC and have been able to bring lawmakers and policymakers to have those one-on-one conversations, and we took about 30 members up to Capitol Hill to do Hill visits. So, I think our opportunities for engagement are growing. There's always opportunities to engage lawmakers at home when often our members are the biggest employers in the district. We've got a story to tell. So it's really a choose your own adventure kind of interaction with policy, and the more the merrier is our approach.
And we also have a phantom email box, which we both staff, but it's policy@chimecentral.org, and we are happy to talk to both members and industry. We routinely do both, and so to Lesley's point, there's really a lot of different ways to interact with us, so we would certainly encourage anyone to reach out to us.
Well, thank you very much for your time.
Thank you.
You guys are always welcome on the show. Always like to hear what's going on.
Okay, thanks very much.
I hope you enjoyed the conversation. Remember to check back often, as we are going to drop an episode a day for most of November of 2019. Following that, please come back every Friday for more great interviews with influencers, and don't forget, every Tuesday we take a look at the news which impacts health IT. If you want to support the fastest growing podcast in the health IT space, here's a few ways that you can do that. The first, share it with a peer, share it with a friend, share it with somebody who's working right there next to you. Number two, sign up for Insights and Staff Meeting. These are services designed to help you in your career. Number three, interact with our social media content on Twitter and LinkedIn. Number four, post or repost our content. And number five, always send me feedback, bill@thisweekinhealthit.com. Your insights continue to shape the channel. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or our YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.